I got here 30 minutes early and then I'm 5 minutes late. How do you like that? Okay, test 1, 2. Okay, so we're live here, I think, on cctexas.com TV. So hello to everybody and good afternoon. It's Thursday today, and this is our bi-monthly press conference now. And I want to tell you we've got some great news to announce. And here is the first piece of it. The first awesome news of the day is that our City County Public Health District has received a grant from the Department of the State Health Services, DSHS, to increase COVID-19 vaccination capacity for the jurisdiction, which is the entire Nueces County. And that means whether you live in the big city of Corpus Christi or the little town of Petronila, all of us in the middle. This grant, hold on to your seats here, is for actually a little over $18 million. And the purpose of this grant is multifold. Let me tell you what it's going to do. Number one, it's going to increase COVID-19 vaccination capacity across the jurisdiction, including high-risk and underserved populations. It will ensure high quality and safe administration of COVID-19 vaccines, and it will ensure equitable distribution and administration of COVID-19. The good news is that it can be used through 2024. I know for some of you, you're going, are we really going to have to deal with COVID through 2024? Yes, we will. We will, but we're proactive now. Now we have the answer to the problem. In 2020, we only had problems. Now we have the answer to the problem. So this is good news. This money will be well suited for our county's needs. Okay, better news is that under the terms of this grant, these funds can be used to pay for costs that we've incurred back to December 1 of 2020. So all expenses charged to this grant for those we've already spent to those that are ahead of us must be directly related to a plan which must be approved in writing by DSHS. The health department intends to request reimbursement for eligible pre-award costs that were already incurred. This helps us tremendously in our budgets of the city and the county. I'm so proud of the team who built our vaccination effort, from these big mega clinics to these fixed clinics at La Palmera to the very small clinics to reach remote areas of our county, all the way to individual outreach with our EMTs and firefighters. I'll ad-lib for just a little bit. I read 4 different news feeds every morning. And I got a kick out of, a couple of days ago, they said that Dallas had this revolutionary idea. They were going to go into people's homes and vaccinate. We've been doing that for months. And prior to January 1, 2020, we had that plan written. And so that's what's really exciting, is you can count on Nueces County not only to be innovative, but to be ahead of the curve. And from the start, the goals of this grant have been the goals of our team. We created capacity to deliver vaccines in quantity, but we also cared about the location and settings that serve those in need the most. We work to deliver vaccines safely, which includes making sure our patients, providers, and those who support us, from law enforcement, traffic control, to those setting up the cones and the shelters, Peter Collins with wireless networks back there, temperature-controlled storage for vaccines. All of us have been a part of that team to be safe, to be effective, to be efficient. We worked to make sure that distribution was equitable. And we're actually creating reports now, monthly, to FEMA, Vaccine Health Equity Reports. I want you to know that this particular subject is near and dear to my heart. And we have a tremendous situation here to recognize, and that's we have a very high population that has many groups at risk and higher proportions than the rest of the state. We've got more elderly, more living in poverty, more with pre-existing conditions, and from the start, health equity has been my priority number 1. Our investing in testing, monitoring, and vaccinating our most vulnerable has saved so many lives and prevented illnesses from getting worse. A big thank you goes out to Dr. Ram, our local health authority, and our public health director, Annette Rodriguez, Dr. Dante, Dr. Luis, and that whole team, Dr. Kim. You know, that's what they believe in, and we believe in them. This grant ensures our efforts can continue and reach everyone, including our high-risk and underserved populations. So, I guess you figured out by now I am excited about this grant. And I know that Director Rodriguez will discuss it probably a little today and probably over the next coming weeks, including all the things this plan is going to enable us to do. I've even seen opportunities to get a mobile clinic that I think we're going to need. We need to make sure that our locations are summer weatherized. It's going to get hot really fast. So we're going to be looking for ways that we can use these dollars to help get us to the vaccination clinics nearest you. So here's something else. I told you about the two pieces of good news. I'm really excited that we've got another positive sign of progress in the battle against coronavirus, and that's we're resuming jury trials at the courthouse. The right to a jury trial is a fundamental safeguard of our constitutional liberties. Most jury trials have been delayed by order of the Texas Supreme Court since March of 2020 due to the pandemic. Now, the order to suspend jury trials has been lifted by the Supreme Court, and our courts here in town have been approved to resume jury trials in person. What does this mean? It means you could possibly be called to report for jury duty. And I want to share with you a video that we've prepared for you today, and we'll put it on all our social media platforms. I know the city will help us to inform potential jurors what we are doing here in Nueces County and our courts to make jury service as safe as possible. If it's okay, are we ready to roll video, or are we going to do that on social media? Okay, we're going to roll video here. While it gets queued up.
The right to a jury trial is a fundamental safeguard of our constitutional liberties. Due to the coronavirus pandemic, most jury trials have been delayed by order of the Texas Supreme Court since March of 2020. Now, the order to suspend jury trials has been lifted, and our courts have been approved to resume jury trials in person. And to have jury trials, you have to have jurors. We've prepared this video to inform potential jurors what we are doing here in our Nueces County courts to make sure your jury service is as safe as possible. The following practices will be observed to facilitate a safe environment inside the Nueces County courts. Social distancing of 6 feet must be observed at all times. Elevators, courtrooms, bathrooms, halls, and other spaces are marked showing maximum capacity for each location to help ensure social distancing, and this capacity must be observed while in the courthouse. You must wear a face covering, shield, or mask over your nose and mouth. If you are unable to comply with this request, please advise the court. Wash or disinfect your hands often, particularly upon entry and after interaction with other people or items. Hand sanitizing stations are located throughout the courthouse for your convenience. Practice good cough etiquette and cover your cough. At check-in, your temperature will be taken and you will undergo a COVID-19 health screening. You may be asked to reschedule if you meet any of the following criteria: cough, shortness of breath or difficulty breathing, fever or chills, muscle or body aches, vomiting or diarrhea, or a sudden loss of taste or smell, or you know you've had close contact with a person diagnosed with or suspected of having COVID-19 within the past 14 days. Due to the unknown aspects of the COVID-19 pandemic, not all situations can be anticipated and changes may be required. Updated information can be found prior to your appearance on the Nueces County website at nuecesco.com/juryduty. Potential jurors should call 361-888-0220 if they have any questions or need further information. Attorneys and pro se litigants should call the court where their case is pending. Jury duty is one of the most important jobs we ask our citizens to perform. We are working to make our courts as safe as possible so you can serve with confidence.
Okay, thanks everybody. So inside the chambers, I really couldn't hear all that well. If you couldn't, don't worry. We're going to make sure that video is available on our social media platforms. But if you did hear it, let me also repeat this last point that was just echoed. Jury duty is one of the most important jobs we're asked to perform as citizens of the United States. We are making every effort to make our courts safe as possible so all those who are called to serve as a juror can serve with confidence. One of the things that I noticed that this particular video doesn't have, but our next one will, is that we've put a lot of effort into the particular air purification systems that have been installed in many of our schools and in government buildings. So this is one asset that we have. In addition, we have plexiglass to separate all of the areas where there could be interfaces. We've purchased new technology so that instead of seeing evidence in the traditional way by hand, we'll use technology to be able to present evidence. And so many other of the healthcare precautions we have taken to make sure our experience together in performing this very important citizenry responsibility is done with the utmost of confidence. So obviously, what we're doing with our courts for everybody, you could be a defendant, a plaintiff, a witness, you could be court personnel. How about a prosecutor or a member of the Corpus Christi Bar Association? This is all this defense that I talk about. And it's all these good hygiene habits that we just articulated. All of these are ways that we can protect one another in this very important public space we call the county courthouse. It's paying attention to symptoms that could be signs of COVID. It's also being courteous and respectful so you can promote health and making certain that wearing a mask and washing your hands and covering your from a cough, these are all tools we have in this game we call defense. But the fact, the very idea that we're going back to jury duty, for me, is a positive sign. It's encouraging. And I want people to feel confident they can serve on a jury safely. But there is also a stark reminder that the virus is still there. Yesterday, just yesterday, while I was on the bench, I received a very heartbreaking email from one of our court managers. She said, "Judge, will you please tell everybody that this virus is still with us?" It took my brother last Saturday. He was 54. Please tell them to stay vigilant. Please tell them to get vaccinated. Please tell them not to stop working hard. This is not over. This personal story of tragedy reminds all of us that while all of these signs that we have, plentiful vaccine, interesting places to receive the vaccine, all kinds of good numbers, things opening again, jury duty resuming, it does not diminish the idea that this disease kills. So let me wrap up by saying that I hope that those who have been on the fence about getting this vaccine, maybe because they felt others needed it more, maybe because they were a little unsure that it was not ready for them, I hope it's your time to come forward and say, it's my turn. And even with the new deadline, the IRS urges taxpayers to file as soon as possible. This is one little tidbit here that we've got going on. And you only have, I think, till next week. And this is sort of just a reminder for you that those who file electronically with direct deposit can get your refunds faster. So while we're here to make certain that that we talk about all our COVID-19, just know that as we get back to normal, there's still all kinds of ways that we're here to help you. And I hope that you jotted that number down if you have any questions. Again, all we need is you. Our clinics are up and running, and every option imaginable is available everywhere. There's got to be one that's right for you. Please, please make this vaccination plan a priority for you and your family. And if there is anything that we can do at the county to help you answer questions, for us to defer to getting you the education that you need, please let us help you in this endeavor. Finally, let me just go back to the beginning. We fought long and hard, and we were ready to spend any amount of money to save lives. the fact that the state of Texas has said you, Nueces County, are entitled to all of this money is a testament to their faith in us. So this idea of we believe in you in doing your part, let me just say congratulations to Annette and to the whole team. Because while I like to encourage all of you listening, this is the inspiration we needed this week to carry on. Thank you to the state of Texas for believing in us. We will not let you down. We will keep the faith, keep up the good work, and we will be able to vaccinate to get to herd immunity. It is not just a goal, it's our mission. Thanks.
El día de hoy tenemos dos noticias importantes que anunciar. La primera es que nuestro Distrito de Salud ha recibido un subsidio del Departamento de Servicios de Salud del Estado para aumentar la capacidad de vacunación contra el COVID-19. Esta subvención es por más de $18 millones y se podrá aumentar la capacidad de vacunación y garantizar la administración segura y de alta calidad de las vacunas COVID-19, así como asegurar la distribución y administración equitativa de las vacunas. Según los términos de la subvención, estos fondos pueden usarse para pagar los costos en los que hemos incurrido desde el 1 de diciembre del 2020. Estoy muy orgullosa del equipo que realiza el gran esfuerzo de vacunación, desde nuestras megaclínicas hasta nuestra clínica fija en La Palmera y nuestras pequeñas clínicas para llegar a las áreas remotas del condado, así como los servicios de los bomberos. Esta subvención garantizará que nuestros esfuerzos puedan continuar y ofrecer servicios en todas las áreas. Otra buena noticia es que estamos reanudando los juicios con jurado en persona en el juzgado del condado. La mayoría de los juicios con jurado se habían retrasado por orden de la Corte Suprema de Texas desde marzo del 2020 debido a la pandemia. Ahora se ha retirado la orden de suspender los juicios con jurado y se ha aprobado que nuestros tribunales se reanuden. El hecho de que volvamos al servicio de jurado es alentador y queremos que las personas se sientan seguras de que pueden formar parte de un jurado de forma segura. También es un recordatorio de que el virus todavía existe. Le quiero recordar que aunque tiene más tiempo por una extensión aprobada por el Servicio de Rentas Internas, es importante que presente su declaración de impuestos. Si realiza su declaración electrónicamente con depósito directo, es la forma más rápida de obtener reembolsos y puede ayudar a algunos contribuyentes a recibir más rápidamente cualquier pago de estímulo restante al que puedan tener derecho.
Thank you. Annette Rodriguez, Public Health Director. I'm going to start with the Nueces County COVID-19 statistics. For the first 2 weeks, you can see the bar graph on the right of me. And for the first 2 weeks, the first week we had 510 COVID-19 cases. And the second part of the week, we had 469. So we are seeing a decrease from last week, which is really good news. Last week's daily, 7-day daily average was 72 COVID patients per day. And this week is 67 cases of COVID-19 in Nueces County per day. The pie diagram basically shows a total of 41,684 COVID cases in Nueces County. That's a cumulative with numbers recovered, 39,774. Active cases of COVID-19, which is still high, 1,136, and then the deaths combined for a total of 41,684 COVID cases in Nueces County since last year. If you look at hospitalizations, you see we started at 45 2 weeks ago, people that were hospitalized on that one day. And then as of today, 46 patients are still hospitalized with COVID-19. So it continues to stay at a plateau that we're continuing to watch. We are seeing a younger trend, which tells us that we have a lot older people, 65 years of age and older, that have been vaccinated, which is a good thing, keeping them out of the hospitals. Now we really need to work on the younger population and getting them vaccinated as well. The ICU patients, if you look at 2 weeks ago, the first 4 days, 13, 14, 13, and 13. If you look at this past week, the last 4 days, 17, 17, 17, 16. So you can see that more people are in the ICU this week than they were last week, and that's not a good trend. And again, we are seeing younger populations hospitalized than previously. The total COVID-19 deaths as of today is 774 cumulative since we started having our first deaths last year. And then if you look at the last slide, the last 2 weeks for fatalities, last week we had 4 deaths in the week. We had some 0 days where we had 0 deaths, which is really good. And then this week, the deaths have gone up to 8 deaths this week. So no deaths today, but 8 deaths this week compared to 4 deaths last week. So I'm going to pivot a minute to the health district. So the health district has been very fortunate, and thank you to Judge Canales for all those kind words. We continue to vaccinate with a sense of urgency. We have vaccinated more than 113,000 people in Nueces County. That's the health district, their staff, the IT people alone. I'm not talking about other providers in Nueces County. I'm talking about only the health district, 113 vaccines. We are currently established at 2 locations, which include La Palmera Mall, where we are vaccinating anytime the mall is open. So there should be no excuse to, I can't make it, because we're open every day, including Sundays. You do not need to have an appointment. You could just walk in and we help you and we take care of you very quickly. We are constantly searching for different ways to bring the vaccine to those who may not be able to attend one of our sites. As such, if you're an employer and you have more than 50 employees and you would like for them to get the vaccine for your staff, please reach out to us at the Health District at 361-826-7200, option 2, and we will work with you to get the vaccines to your site. For those who will be visiting Buck Days, starting tomorrow, today Buck Days opens. I think tonight is Dollar Days, but starting tomorrow, we will have the vaccine available there on site. So we'll be there Monday through Friday, again, not today, but Monday through Friday from 5 p.m. to 8 p.m. and Saturdays and Sundays from noon to 4 p.m. We're in partnership with the Buck Commission, who has graciously offered us vouchers to give to you that decide that you want to get vaccinated there at the Buck Carnival tomorrow night. We will give you a voucher if you get vaccinated, and then you can go into the carnival for free. So we will have both Moderna and Pfizer vaccine available for those 16 years and older. Next month, many of our school years will be coming to an end. Congratulations to all of those that will be graduating, those seniors. We know it's been a tough year with many celebrations that had to be canceled because of COVID. I can only tell you that you will be forever resilient. For those who will be coming back for another school year, the Corpus Christi Nueces County Public Health District will start back-to-school immunizations earlier this year. The reason is twofold. One is we want to make sure that all students can get the needed vaccine before the back-to-school rush. The second is we are confident that a pediatric COVID-19 vaccine will be available very soon. One of the requirements for receiving the COVID-19 vaccine is that anyone who is receiving the vaccine must not have received another vaccine within the last 14 days. If all students receive their up-to-date back-to-school vaccines early, we won't have that concern to worry with. Some of the vaccines that are required for back-to-school are, the ones that get the most vaccines are going to be the little ones that are entering school for the first time. For kindergarten entry, it's the DTaP, it's the IPV, it's the MMR, it's the varicella, and it's the hepatitis A that's required to start school. For grade 7, you're also going to require the Tdap, the meningitis, and the HPV. For the 16-year-olds, and that's why I'm talking about these 16-year-olds, they're going to need a meningitis shot. And so it's very important that they get their meningitis shot now, or they get their COVID vaccine now, and they get their meningitis shot later, but they don't want to take them within 14 days of each other. The COVID-19 vaccine is not required at this time for students enrolled in K through 12th grade, and the COVID-19 vaccine, again, should be administered alone with a minimum interval of 14 days before or after administration of any other vaccine. There is no cost for the COVID vaccine from any provider. Also, for those of you that have not heard, FEMA currently has money available to help pay for funeral costs, up to $9,000 for COVID-19 related deaths. And the website, you can see it here, is www.fema.gov/disasters/economic/funeral-assistance. Or they are going to be getting a 1-800 number. They don't have it up yet, so when they do have it, I'll bring that back to you. But there's also a contact at the Congressional Affairs Office, and that's 202-646-4500. So any COVID-19 related death cost from last year, January of 2020 to the present, can be covered. So, as always, stay protected and stay informed. Thank you.
El Distrito de Salud ha administrado más de 113,000 vacunas en el condado de Nueces. Actualmente estamos establecidos en 2 ubicaciones que incluyen el Centro Comercial La Palmera. No hace falta tener citas y los tiempos de espera son muy cortos. También podemos ofrecer la vacunación en lugares de trabajo. Para más detalles, llame al 826-7200, opción 2, y trabajaremos con usted para llevar la vacuna a su sitio. Esto es para aquellos lugares de trabajo con más de 50 empleados. Durante los días de los bucaneros tendremos la vacuna disponible de lunes a viernes de 5 de la tarde a 8 de la noche y sábados y domingos de mediodía a 4 de la tarde. Las personas que reciben ahí la vacuna podrán ingresar de manera gratuita. Se puede registrar de manera previa. Vamos a contar con las vacunas Moderna y Pfizer para los mayores de 16 años. Pronto termina el año escolar y para aquellos que regresan a clases, el Distrito de Salud Pública del Condado comenzará las vacunas escolares de regreso a principios de este año. La razón es doble. 1, para asegurarnos de que todos los estudiantes reciban la vacuna necesaria. Y 2, estamos seguros de que muy pronto estará disponible una vacuna pediátrica contra el COVID-19. Algunas de las vacunas que se requieren para el regreso a clases son para aquellos quienes ingresan al jardín de niños, para quienes van a acudir al 7º grado, para los jóvenes de 16 años necesitan un refuerzo contra la meningitis y la vacuna COVID-19 hasta el momento no se requiere para los estudiantes inscritos en los grados de kindergarten al grado número 12. La vacuna COVID-19 debe administrarse sola, con un intervalo mínimo de 14 días antes o después de la administración de cualquier otra vacuna. Para más información, llame al Departamento de Inmunización al 826-7238. El costo de las vacunas es de $10, pero el costo de la vacuna contra el COVID es gratuita. Asimismo, FEMA también cuenta con ayuda monetaria para pagos por funerales vinculados con fallecimientos por el COVID-19. Estos pagos pueden ser de hasta $9,000. En solo unos días habrá un número directo para poder comunicarse directamente con FEMA.
Thank you, Gabby. That concludes our press conference, and we will be back 2 weeks from today for the next COVID-19 update. Thank you.